How does R-CHOP chemotherapy work for lymphoma? Imagine a team of specialized medicines working together to fight lymphoma, a type of blood cancer that starts in the lymphatic system. R-CHOP is a combination of for chemotherapy drugs, a targeted therapy, and a steroid, all designed to attack cancer cells from different angles. This approach makes it more effective than using just one drug alone. The first part of this team is Rituximab, a monoclonal antibody that specifically targets a protein called CD20 on the surface of B-cell lymphoma cells. By binding to this protein, Rituximab flags the cancer cells for the immune system to recognize and destroy. It acts like a homing device, guiding the body's natural defenses directly to the cancer. Next is Cyclophosphamide, a chemotherapy drug that interferes with the DNA inside cancer cells. It prevents these cells from copying their DNA, which stops them from dividing and growing. Without the ability to replicate their DNA, the cancer cells eventually die. Doxorubicin, another chemotherapy agent, damages the DNA of lymphoma cells and inhibits enzymes that are essential for their growth. This damage makes it impossible for the cancer cells to survive or multiply. Vincristine, also called Oncovin, works differently by disrupting microtubules, which are structures that help cells divide. When microtubules are blocked, the cancer cells cannot successfully divide, leading to their death. Finally, Prednisone is a corticosteroid that helps kill lymphoma cells directly and reduces inflammation caused by the disease. It also helps manage side effects of the other drugs, making the treatment more tolerable. Together, these drugs attack lymphoma cells in multiple ways, damaging their DNA, stopping their ability to divide, and marking them for destruction by the immune system. This multi-pronged attack is what makes R-CHOP a standard first-line treatment for many B-cell lymphomas, especially diffuse large B-cell lymphoma. R-CHOP is usually given in cycles, typically every 3 weeks, to give the body time to recover between treatments. The total number of cycles can range from 3 to 6, depending on the stage of the lymphoma and how the patient responds. Doctors often use imaging tests like PET or CORT scans after some cycles to see how well the treatment is working. In some cases, especially with advanced disease or higher risk of relapse, additional treatments like high-dose chemotherapy with stem cell support or intrathecal chemotherapy, given directly into the spinal fluid, may be recommended to prevent spread to the brain or spinal cord. While R-CHOP can cure about 70% of patients with diffuse large B-cell lymphoma, some cancers may develop resistance over time. This resistance can happen due to genetic changes in the cancer cells or the protective environment around the tumor. Ongoing research aims to understand these mechanisms better and develop new therapies to overcome resistance. In summary, R-CHOP works by combining drugs that kill lymphoma cells through different mechanisms with a targeted antibody that helps the immune system recognize and destroy cancer. It remains a cornerstone of treatment for many B-cell lymphomas, but treatment plans are always tailored to each individual based on their disease stage, overall health, and how they respond to therapy. Always consult with an oncology specialist for personalized advice and care.